The treatment of a lateral condyle fracture of the humerus with reduction and fixation using a plate involves several crucial steps. This kind of fracture affects the elbow joint. The goal of treatment is to restore the anatomy of the elbow, ensure stable fixation, and allow for early motion to prevent stiffness. Here's the procedure. The surgeon will decide on the type of plate and fixation technique based on the fracture's characteristics. Fracture reduction. The fractured pieces of the lateral condyle are manipulated and aligned to their correct anatomical position. This step is crucial for the function of the elbow joint. Fixation. The plate is positioned and fixed with screws, ensuring that the fracture is securely stabilized. The screws are placed in a way that they compress the fracture fragments together to promote healing. Post-operative care. A splint or cast may be applied to immobilize the elbow temporarily. Post-operative care involves pain management, infection prevention, and possibly antibiotics.